According to recent statistics, millions of women around the globe live with stress urinary incontinence or pelvic organ prolapse, and in many cases, they live with both. In the majority of these cases, the severity for these conditions is considered mild, requiring only non-invasive means of management. Some cases, however, are more severe and may require surgical intervention.
In the case of pelvic organ prolapse, we've got several surgical procedures. Sometimes we have to combine more than one procedure in a single operation. However, we have to expect the fact that failure rate with such operations is as high as 30%, and a woman may expect to have more than one operation if she wants to have another operation. When we talk about non-invasive procedure here, in the case of POP, there's only one modality of treatment, and that's by using pessaries, which are mechanical devices inserted into the vagina. Once within the vagina, they just mechanically lift up the prolapsed organ. They're good, they function very well. However, the atmosphere around them just causes women to be reluctant to use them. The one is the fact that they are all reusable. A woman comes to the doctor, he takes out the used pessary from the vagina, just cleans the pessary and reinsert the same pessary into the vagina for another 3 months. And then she comes again and the same procedure goes on and on. In most cases, they are inserted and removed in more or less the same size. This is why it goes together with what we call loss of time and the fact that the woman has to go into the office very often and just have discomfort at the same time. This is why the dropout rate from using such devices is rather high.
The original market was quite conservative, a reality that did not suit the needs and the way of thinking of the modern woman. This is because the majority of women wish to be in control of their medical treatment with minimal disturbance to their daily life. You can hardly find companies like ConTIPI which are focused with the development of medical devices for women's health industry. The main challenge is, on one hand, to develop products that are innovative but simple to use, but on the other hand, comply with stringent standards and regulation of the healthcare industry.
Living with POP or SUI can be uncomfortable, awkward, and limiting. But with recent advancements in medical devices, there are now non-invasive options that help women get their freedom and independence back. Located in beautiful Caesarea, Israel, ConTIPI Medical was founded by a urogynecologist in order to provide non-invasive and disposable solutions for the management of various pelvic floor disorders in women, with the mission to shift control into the hands of women, helping them get their freedom back.
ConTIPI works in the pelvic floor arena only, and we only develop non-invasive and disposable vaginal device for women with pelvic floor disorders. All our devices follow a very specific concept, and during the development of these devices, we have consulted a lot with women just in order to try and understand what they wish to have from the devices and how they would like the devices to change their lifestyle. Not only that, but at the end of the day, these devices that employ a very easy and very specific way of inserting and removing the device, which is very well known to most women around the world.
Working at ConTIPI, I've seen many medical conditions in women which may be solved by employing really innovative thinking. Here at ConTIPI, practical and simple solutions are designed with the collaboration of actual patients.
During development of the TIPI Impressor device, we started developing another device, this time for pelvic organ prolapse. As I mentioned earlier, most of the women will only require non-invasive treatment for pelvic organ prolapse, and we wanted to bring something new in this specific arena. So we developed a device which followed the same concept. The device is fully developed, has a CE mark for marketing in Europe, but it's still considered an investigational device in the United States. As I mentioned, the device follows the same concept and it becomes a Rink Pessary when it's already inserted within the vagina. As with the other parts of the concept, the device is inserted in small dimensions into the vagina within an applicator, and it opens to become a ring, and then it remains in the vagina for up to 7 days, or up to the time that the woman decides that she wants to take it out. She may even take it out after 5 minutes or 10 hours after insertion. This is up to her, and this is what we call the freedom to choose. The device may become small again for removal whenever she pulls the string, and then the device is taken out of the vagina for disposal, and again, as mentioned earlier, cannot be reused.
We know most women are not willing to disclose their medical condition and do not express their wishes. At ConTIPI, we have taken things one step forward with our new creative and discreet devices to allow women to choose their own lifestyle, and we hope that other companies will follow.
Yes, we noted that more and more women want to be in control of the problem. And I think the new concept we developed is something that's really life-changing. And let's talk about 2 points that will show you, or will give you an example to this. The first is talking about the market. When we look at what we have in the market today, for the last 25 years, there hasn't been any new innovation whatsoever. So whatever we use today is at least 25 years old. On the other hand, we have growing and aging population, and we expect that to reach an epidemic proportion in about 2 to 3 decades. So more and more women will need new devices or new modalities of treatment. And on the other hand, the insurance or the medical system will probably approve more and more modalities of treatment, which will enable women to take control of the problem at home, not using the medical facilities. There's also a shift of control in here. It means control moves from the hands of the medical arena into the hands of the women. And this is why we also think that these devices are not only a medical solution, but also a social solution. Because once they're here, more and more women will be allowed to be involved in the society and just be free of whatever the previous restrictions they had.
To learn more, visit us online at contipi.com.